Appreciate it. So, hello and welcome to the delegates and esteemed guests that are attending Healthcare Innovation Summit Africa 2021. So, as indicated, I'm the head of the healthcare practice for Gijima, and now focus with today's session and then try to keep it as short as possible and maybe allow for questions and comments and interactions post the presentation. Try to keep it as brief as possible. Gijima has been in the healthcare technology field for over 2 decades, and our focus has been looking at how we accelerate digitization efforts in healthcare within the African space currently. So this focus today is to tell you what we've done, where we are, and where we see the future in terms of digitization efforts in Africa. Uh, For this particular presentation, I'm going to focus specifically on a few takeaways and learning outcomes. What we've done is we've obviously been working with hospitals, clinics, and other segments within the healthcare sector. And over the years of trying to deploy technology solutions, as well as the other components of infrastructure and connectivity and security, we've discovered there are specific key challenges that exist. And over the 2 decades of working in both public and private healthcare space, these key challenges evolved and these themes have changed over time when it came to digitization efforts. And what we all know is the global pandemic of COVID-19 has kind of created a bit of a paradigm shift in terms of how stakeholders perceive where they want to in terms of digitization efforts. What we're seeing currently is there is no there's a need for you to actually drive digitization efforts. And the reason for that is one, to automate and virtualize your provision of healthcare services. Secondly, to align with uh, national strategies, which is the e-health strategies, the National Health Insurance Bill, the NDB 2030. So the concept is to drive e-health and create interoperability, which is currently to an extent lacking within the African continent. What we're also trying to do based on the experiences we've had is where we obviously taking the approach of implementing silo and legacy IT approaches for many years, there's a move towards scaling up to a more enterprise approach and using best practices and taking lessons learned from tier one type of organizations globally and bringing those international benchmarks back into South Africa. So what we've been trying to do is our new portfolio takes into consideration how we align to global best practice and international accreditation standards. What we are doing as Gijima is in order to ensure we deliver and be part of the drive towards delivering accessible healthcare within the African continent, we've invested a lot in R&D in the solutions we have taken to market, and we work very closely with public and private healthcare customers to ensure we provide realizable value outcomes. Now, whilst we're still looking at automating workflows and there's still very heavy paper environments, philosophically, what we're trying to do is besides driving the digitization efforts and taking healthcare service providers to a more mature IT universe state, we also want to ensure that they have the access to smart technology, the Internet of Things, and we obviously innovate within the country. So we want to basically serve as the benchmark providers of healthcare transformation within the African continent. So specifically, what I'd like to hope is these are the takeaways you would see in our particular presentation. Now, we're going to talk very briefly about what are the key drivers that have made us decide this is the approach we want to take to digitizing healthcare in Africa. Now, we've obviously spent more than 2 decades understanding the challenges of technology adoption in the healthcare space. And what we've witnessed is Africa is maturing over time. And I think we're at that point where digital transformation and IT maturity and the innovation aspects of it we're seeing realized. And these themes that currently exist within the minds of IT managers and CIOs, you'll see in the slide presentation before. So our digitization efforts, which we gearing towards the next 10 to 20 years, taking us to the National Development Plan of 2030, where we wish to align, is these are, we feel, the key elements that a lot of CIOs and IT managers are focusing on. Things like accelerating your technology implementation, because the concept of paper environments are cumbersome, not cost effective. The challenges around not scaling your data to being scalable and portable, and obviously access of healthcare can be circumvented through technology adoption. So these are some of the elements we feel are the concept we focus on. So when we've developed our future state strategy and where we see healthcare technology adoption, and even the development, design, build, and implementation of healthcare facilities, be it a tier one hospital to a simple outreach clinic that just screens patients. We want to ensure that we can cover that entire value chain, and to cover the entire value chain, these are the critical elements most healthcare service providers are facing. We know, as an example, if you look at the particular screen at the bottom, we're looking at big data and health analytics. Everyone knows that's the buzzword. The challenge we have is a lot of organizations are building their own reporting data and healthcare analytics, and meeting their specific needs. And the cost of that is quite exorbitant. So there's a challenge in terms of reporting, and a lot of organizations using very simple principles to get that done. What we're saying is, as an organization that's working with global partners, and we have the solutions and services and the components that provide big data and health analytics, in the future, we'd like to maybe have an enterprise platform where data sits on a repository. It obviously meets international standards. There's a vocabulary in place, but we can probably sell through subscription services your entire reporting and health analytics from a cloud-based, platform. So taking the heavy lift away from you having to build your entire infrastructure, then buy solutions and services to be able to deliver your data and health analytics or reporting. We're saying we would take standard approaches. We'll come with toolkit reports and health analytics, and you subscribe to get those services based on your data and obviously conformity protection and the POPI Act in a sense. So in a sense, these are some of the themes that we are currently focusing on, and these themes uh, evolved over a period of time and has basically driven what we want to drive in terms of what is the digitization efforts in healthcare. Now, these digitization efforts obviously lead us to where do we wish to be in 2030. So whilst we're a tech service and solutions partner, our vision is to be part of the entire healthcare ecosystem in both public and private sector. We want to see better integration between these two entities. So what we're saying is, how do we create a future state, and where do we see the vision of healthcare in 2030 from a tech perspective as well as healthcare facilities? So what you're going to see next is a piece of work that we created, and I'm going to take you very briefly to what this is. So Gijima's approach to driving healthcare digital transformation towards an interoperable paperless environment is this particular vision of the future. So we're saying this will be possibly a future mode of operations that obviously is subscribed to, taking you through a journey from operating your hospital to then evolving into a bit more of a mature state where there's recognized sophistication in your IT universe, and then mapping up to world class. And when you get to world class status, you obviously are aligning to international best practice accreditation standards. So just to give you a feel of this particular bit of IP that we created, what we're saying in 2030 is, how do we create a platform? So we want to create, we're calling it a citizen-centric platform that basically will cover the entire healthcare value chain, but it will integrate all the role players within the healthcare provision of healthcare. And we're saying between your healthcare service providers to your citizen to your public sector, I'm calling it an integrated delivery network. So how do we bring that integrated delivery network to a mature state, and who's going to drive those ideas? And this is the creation of one of our 2030 vision statements. And how this to extrapolate this in a bit more detail is, if you look at the central core HMS circle, which HMS means your healthcare management system. What we're saying is, for any healthcare facility, no matter the market segment, and for now, let's focus on a tier one type of organization, a hospital of, let's say, 150 beds. That's a multi-specialty. So the needs are simple. Immediately, your need is to be able to register a patient, capture demographics, be able to book them in for a service, whether it's an outpatient or inpatient environment. You want to be able to record the services that are done and create an electronic health record that identifies all the activities that took place during a particular episode of care, and a unique identifier that identifies that patient. So what's that minimum data set that we can make scalable and portable to take to different organizations, whether it be in public and private sector? So we're saying, in order to create that interoperable environment, we all need to have a core healthcare management system that takes care of your patient administration or patient management, your patient accounting and billing, and then move into the clinical workspace where you do nursing documentation, you can order services. But the secret here is, how do we get that data to an enterprise level where it conforms to a standard data vocabulary that's recognized by systems irrespective of their architecture or innovation. And this is where Gijima is driving these sort of ideas. We want to create that minimum data set that's scalable and portable, that every citizen can move from one institution to another, whether it be public and private. And most hospitals want to go through this transformation journey. So, the concept of Big Bang Theory, where clinicians are more, need more time with patient care, we're trying to move away from that and saying scale up through a maturity model, which is what we've created here. So the concept is that core HMS, there are basic functionality required in your technology solution. And as you scale up in mature, you want to go into things that are more mature in the sense of, let's say we do things like e-prescriptions, where when you're leaving a hospital, you're actually able to get a digital prescription, which could go directly to your mobile platform in your phone, or to a dedicated pharmacy for dispensing. And that entire cycle of uh, we call it the closed loop medication management is covered in terms of workflow automation. So this is taking you to a mature level. And for example, a lot of physicians today still are comfortable with using paper-driven electronic medical records. So how do we work around those solutions? And we as a company are creating a portal where we bring in the best-in-class solutions from board to close the gap that completes this healthcare ecosystem for the future state. So as an example, your physician doesn't want to write a prescription or write clinical notes. We give them the option of dictation or transcription system solutions, and we make their efficiency and workflow much more easier, so they have more time to spend with the patient. But then we have that converted to data, which now can be reusable and valuable, from a national perspective. So to give you a global look at this particular Vision 2030, is we start off with the core functionality requirements of managing your healthcare environment. Then we take it to an outer layer, which is the white circle, and shows you some of the applications or solutions you need. Like, do you need a pharmacy or lab solution within your ecosystem? If you're that size, yes. And then you buy an LIS system, which is part of an integrated solution. But the philosophy is, the cost of these solutions are expensive. We want to take it to a level where we're saying we want to provide you deployment options that reduces your capex investment, and more OPEX kind of operating model. So we're working toward Vision 2030, where we're very conscious of cost and how we can actually deploy these global type solutions and enable this business capability in your environment for a future state. And then the outer circle takes you to the whole world-class environment. And we are now talking to international accreditation bodies like HIMSS, where you probably have heard of the HIMSS MRAM model, where if your hospital goes through an IC maturity, you're certified up to HIMSS MRAM stage 7, which shows you are quite sophisticated, and you brought in things like evidence-based medicines that guides your physicians when they make their decisions, or you have clinical care pathways, which is a scripted pathway that has decision points, and as you make a decision, it tells you which direction to go, probably based on a DRG or an ICD code. So you will notice the bandwidth of individuals in our company. We are thought leaders and that have worked internationally and locally. We've done tier one type projects in the millions of dollars. We've implemented these sophisticated, landscapes both in Africa and abroad. So what we're saying is these are tried and tested methods. We've developed this IP. It's been recognized by organizations like HIMSS, and we're saying we are well positioned as the go-to gurus within the country to help drive these initiatives, which will close that gap between public and private sector, and obviously help drive initiatives around NHI and the NDP 2030. So if you look at the circles you've seen, that's basically the capability that we want to bring to a hospital up to 2030. And obviously the models are cloud-based or subscription-based services. We want to look at that. What we're saying is, in order to extrapolate that a bit further and bring the intelligence behind your application, we're saying we're now building this ecosystem where when we come in, we don't necessarily want to sell a solution to you. We want to understand your business issue. We may want to say, you have a business problem. It may not necessarily need a solution of technology. There may be advisory consulting or business process improvement or some lean and Six Sigma stuff where you remove wastage. We're saying we want to be those go-to gurus to help you drive those initiatives. So when you do decide to buy a piece of technology, you make an informed decision, and your TCO, your total cost of ownership, is cognizant of your future state. And we build this environment where we say To run these applications, you'll need an ICT environment, maybe your network security, cloud computing. We're saying we can literally bring that healthcare in a box concept. I'm going to reflect on that in the next slide. But the concept is what we're trying to do is build an ecosystem of solutions that takes you to a future state paperless environment, complemented by all the ancillaries you require to run that environment. And we creating the portal for those international organizations to come in, and we're setting the benchmarks within Africa. So what we are seeing based on the work we've done over more than 2 decades is we are bringing in those international standards and benchmarks as well as best practice, and you've got the experts on the ground, and we'd obviously like to speak to you. Now, based on this vision of 2030, our portfolio obviously will grow. So I've joined Gijima recently, and an amazing bit of work has come up where we've decided this is actually the footprint we want to take to market based on the 2030 vision. So the concept is to develop a healthcare center of excellence that is designed to provide fit-for-purpose localized solutions and services that are innovative, they're interoperable, very quick to implement, and deploying in different platforms to afford you a better total cost of ownership and reduce your capex, cost in a sense. So we're saying we're designing a portfolio, not necessarily solutions, but other components to deliver healthcare to areas that have not seen it before at an investment that we're bringing in. So I'm going to give you an example of some of the areas we're focusing on. So if you look at this particular portfolio we developed, so it's our healthcare footprint that will drive digitization efforts in Africa. We're saying this healthcare center of excellence will basically be a portal where we not only sell tech solutions and services, but we're here to hold your hand and guide you from an advisory consulting perspective. We've got healthcare enterprise architects that have done some phenomenal work globally and locally. We've got a house full of developers that can really do customization of any solution you may have, or we develop from ground up fit for purpose solutions. We're saying our market segmentation is not only the big tier one hospitals. We're looking at every market segment and that which forms part of the integrated delivery network. So if you look at this, not to go into too much of detail, our digital solutions cover things like an entire end-to-end hospital information system. I call it an HMS. You got your whole patient administration stuff, the billing and back office functions that exist. We are developing the concept of an electronic health record, and the electronic health record is that EMR that's scalable across, organization. So it's fit for purpose, both public and private sector. So we're saying, let's create that EHR with a minimum data set that's scalable and portable that everyone can use, and it's readily available, and the data is protected. So just you can go through some of the solutions by reading it. What we're saying is that we literally can do end-to-end solutions for your entire healthcare value chain. And to give you an example of some of the initiatives we have, so we've now partnered with a global organization where we're offering what we're calling it a healthcare in a box, or we call it turnkey hospitals and medical facilities, where literally we can bring into Africa container type hospitals starting at the minimum 100 bed size or even less than that. So literally a container type solution with solutions that have been localized for our environment that covers every sort of speciality as well as acute care within Africa. But we're saying besides the actual build of the containers, which is covers the entire value chain and services offered in a multi-specialty hospital, we literally will provide you the infrastructure from a hosting perspective. We'll literally connect you through mobile connectivity, or provide the network connectivity you need to run your technology. We literally will fit out that entire hospital with your equipment, your beds, and your design, and we will then run the entire hospital for you through managed services, where you literally come in and you're paying OPEX costs and we run it. So we've now partnered with an American company that's probably one of the best in the world that does mobile/container type hospitals, and we're now ready to take this to market. So the vision there is, and understand where Gijima's investment comes in. So whilst we are a for-profit organization and we obviously want to keep our company alive and sustain, there's a lot of R&D from our group chair as well as the stakeholders within the company say, listen, how are we giving back to our community within South Africa and Africa? And this is one of those initiatives where we're investing in this particular entity, and we want to take this to market merely for the purpose of service provision and creating accessible healthcare to all. So we're partnering with the major telcos to understand how we can use GSM to obviously connect where there's no hardwire connections. And so these kind of healthcare in a box concept have been built and ready to go to market. I'm not going to dig too much deeper into our partner solutions, but it gives you a feel of some of the companies we've started bringing into Africa, and we're providing them a portal to showcase their solutions. And then we've got this other division within the Healthcare Center of Excellence, which we're calling our Digital Innovation Hub. Now, that's where all the exciting stuff happens. So if we see there's a gap in the market or a business need, we then have the expertise, the know-how, and the network locally and globally to bring things like smart technology, Internet of Things, wearable technology, scaling up to doing remote monitoring of patients, even looking at home healthcare services. So there's some exciting concepts exist. So what you're hearing is, from Gijima's perspective, we've taken on the experts that understand the industry. We've got a combination of expertise that goes in years, and we'll speak to some of Gijima's, success stories in the next slide. But this is the feel of a starting footprint, which will mature over time. And bear in mind, those challenges that IT directors and managers are facing will evolve over time. And we have built a very live, living, dynamic approach to how we digitize healthcare in Africa. I'm not going to spend too much of time on who we are as an organization, but literally speaking, Gijima has been around for 27 years in South Africa. We've got a massive team of more than 3,000 employees that cover functional experts, implementers, sales teams. We've got developers, we've got enterprise architects. So, and they cover all the different aspects. So we are partners with literally all the major tech service providers within Africa from a global perspective, be it Microsoft, Oracle, Sage. So we're platinum or gold partners, and our success rate has been very high. So you'll see in terms of the geography, we literally placed in about 16 regions within South Africa alone. Everyone knows we're a BBE double E level 1, and besides the healthcare ecosystem and the solutions we provide there, we complement that portfolio with being able to provide infrastructure and cloud services, enabling business, where we enable people in business through the provision of secure and connected collaborative solutions. Your digital transformation, we literally help you innovate where your digital environment is and take you to a future state. And I like the philosophy of enterprise architecture. So imagine us coming in and creating an as-is state of your current IT universe, where these assets can be managed and maintained for the future state, and you're able to plot your a helicopter view of the future state. And before you make any investments in your technology, services, or solutions, we're able to map your future state and help you reduce your TCO and make decisions that in the end affect your bottom line, and you reduce your cost in terms of IT. Whether we like it or not, delegates, IT is no longer on the back burner. It's now on on the critical path, and COVID has taught us that. So the luxury of being paper heavy, it is no longer a comfort we can afford. Security by design, obviously, cybersecurity. We've actually got the only cybersecurity center in South Africa. We service Europe and America to an extent. We've got a tier 3 data center, which we've acquired through our merger with T-Systems, and we've got lots of customers on there, and a lot of the OPEX models come out of it, and customers are very comfortable with what we've done. Now, bear in mind the solutions that we work with and the implementations we've done, which you'll see in the next slide in terms of success stories. Have So there are 2 decades of localization and customization efforts. So we have spent the R&D and the investment in localizing solutions based on customer feedback as we've implemented over 2 decades. And the result of that is, one, we're the only service providers who have a fully integrated, localized, enhanced healthcare solution for South Africa. And we've taken the legwork out of you needing to customize. So we've done all the EDI stuff with your claims administrators, as example, Medicredit. So everything is literally online. Your solutions are of the latest technology, and there are sometimes concerns around where's the innovation going in the future. What if we buy a solution and it sunset? The reality is, with our partners, we've actually invested, and because of the successes we've had within South Africa, our partners have invested in R&D and have decided to scale the product to a future state. So we're currently going through an innovation transformation with some of our solutions, be it healthcare, back office, or ancillaries, and we're busy driving product development roadmaps where it is driven by our customers and users, and they're part of the experience that, or designing the experience they would have with the solutions. So, in terms of and a lot of what we do is not only plug in a solution and walk away. We then generally take over managed services, which is very cost effective and build by ticket. So we've had a lot of success when it comes to our SLAs in our customers. When we say 175 years of local healthcare team, if you take the ages and experience, I've been in the industry for 27 years, coming from a pharmacy background, moving into healthcare tech, being an enterprise architect, doing global projects. So this kind of expertise, considered as global thought leaders in healthcare IT, exists in the country, and we're saying we want to now bring that knowledge to public sector and private sector and help drive some of the initiatives together with your inputs and where we move forward. So simply put, some of our logos are presented here. We've done very well in the private sector. Very good news is that late last October, we signed up with the Gauteng Department of Health. So an initiative which is massive for us and the country, where they've actually decided to go with a COT solution that's mature, localized, and not having to spend a lot of money on the development side of stuff and a lot of customization and the challenges around it. You don't need to then go to proof of concept. You don't need to do user testing. Your solutions are ready, and we bring them toolkitted, meaning you have pre-built templates, you have content, you have workflows embedded in there. So the idea is we take a lot of that work around how long it takes to implement, so accelerate implementation. So in a nutshell, this is Gijima as an organization, as well as our vision for digitization in healthcare. We are aligning to the future state of healthcare in Africa. We are cognizant of public and private healthcare, and we're saying we definitely are the good to go-to gurus, and we're here to support your initiatives. So I hope this was a very good, quick, concise presentation of what we do and what we can do, and we invite you to have just general discussions with us, because we also love hearing and learning from the stakeholders that exist in this presentation. Thank you all.
Thank you so much, Shiraz. That was a really excellent presentation, and fascinating to see just how developed the sector is and how far you've gone in Gijima and the range of your services. And I know that there are many other suppliers, who are working in this area, but you've got a great company going on there, and you've been able to bring it together in South Africa and introduce some innovations there, which I think we can all be impressed and proud of, really. I think it's a very good talk, and thank you very much indeed. There are some questions. We have about a minute or two for questions before we move off, if anyone wants to put anything up there for Shiraz. Lots of likes going up there. You can press the like button as well, and that gives a nice bit of feedback for the speaker. So thank you. That's it. So a very popular talk, and I also found that fascinating, and we'll also be talking to you, I'm sure, at some point to get some more information about what you're doing. And I hope other delegates do and reach out to you, Shiraz, and I'm sure you'll be available for that, won't you?
Yeah, absolutely. And what we're trying to do, Jonathan, is we're obviously part of the stakeholder committee or steering committee that's driving benchmarking in South Africa. So, I must compliment CSIR together with Department of Health. They're busy building the healthcare normative standards framework. These initiatives are exciting for South Africa, and I think as both private organizations that are here for profit and public, it's time to collaborate. It's time we set aside the differences. I think if we all contribute to the future of Africa, we really have some amazing stuff going on here, and the intelligence we have within the country, I think the biggest challenge we really have is just getting them together and collaborating. And a few organizations should drive the initiatives and be patient, and I think we can get to a future state that will make us be recognized as global leaders in healthcare tech adoption.
I couldn't second that more. I think one of the great tendencies coming out in understanding global business, whereas we've been teaching people about competitive paradigms for so many decades, it's actually the intelligent collaborative paradigms where you may compete in other areas, but you collectively come together to make the pie and the capability bigger for everybody. And that's certainly the way for national growth, national capability, and to build a sector. And there's absolutely no reason why we can't be world leaders in this area, with that sort of collaboration and time.
Absolutely. Thanks for very constructive feedback. Thank you.
Good. Thank you very much indeed. Now, thank you, everybody. We've got a 15-minute break now for those of you who would like to get a coffee or a herbal tea or whatever it is that's the flavor of the day at the moment. So it's now 12:47. Well, if you could come back at 1300, 1302, actually latest, really appreciate it. And we've got a very good presentation coming up by Tanishan Naidu of MedShield, which is a practical case study, which is one of those things we all need to bring together to understand how these applications happen. Because moving from the abstract to the concrete is quite hard, not only in our minds, but in real world as well. So you're going to get some interesting insights into the challenges, both human and technological and medical, about making those transitions. So take your 15 minutes, please. Look forward to seeing you back here in 15 minutes. And thank you very much for your time. And again, Shiraz, thank you so much for a great presentation.
Thank you, everyone, for attending.
Welcome to the tomorrow of healthcare in the Oracle Cloud. A place where disruption is your reality and digital agility is the cost of entry. This is a world that rewards those who embrace bold ideas, fueled by intelligent data. This is a place where healthcare stays focused on caregiving, where health plans, hospitals, and health systems become active enablers, engaging patients as dynamic participants in their own wellness, where every aspect of the business of healthcare is orchestrated for organizations, intelligently automating, reducing human error, freeing you to progress your mission, where healthcare professionals are nurtured, developed, and given real-time feedback to help them better care for others, where operational excellence and people-first experiences meet clinical excellence, where administrators and caregivers work as one, intelligently and proactively gaining the insight to focus services and resources where they have the greatest impact. Take command of the digital age. The future of healthcare in the Oracle Cloud.
Everyone in a hospital is there for a different reason, and everyone sees a different part of it. Some see waiting rooms and receptionists. Others see patients, doctors, nurses, and family members. The nurses see something else, as do the doctors. The people in charge of supplies see something completely different, as do buyers and all of our supply chain partners. But hardly anyone sees the whole hospital, from clinical to operational, except you. You understand how deep this goes, all the systems involved, the complexity of their interactions, and how to be resilient when things get tough. Managing next-level complexity requires the right tools. Having a digital platform is essential for operational excellence. And Oracle's comprehensive solutions for healthcare providers handle everything: financials, human resources, customer service, and supply chain operations, all from a unified suite of applications, enabling a single source of truth. It's an integrated management system for making better decisions while increasing efficiency, lowering costs, supporting clinical excellence, and most of all, improving patient satisfaction. Good outcomes are the result of a whole lot of things going right. Most people never see, but matter a whole lot. Find out how Oracle is transforming the future of healthcare.
Complex, costly, difficult to manage, out of date. More healthcare organizations are turning away from complex and expensive legacy branch routers and MPLS lines in favor of secure SD-WAN solutions to become cloud-ready, improve overall user experience, meet HIPAA compliance, and increase high availability to critical patient care locations such as hospitals, clinics, and standalone emergency care centers. SD-WAN solutions aren't just easy to manage, they also simplify WAN operations overall. But at Fortinet, We know that a true solution is only achieved when the networking and connectivity functionalities of SD-WAN are combined with security functionalities, all running on the same appliance with the same operating system managed by a single console. If SD-WAN offerings don't include security, they're little more than another conduit for cyber attacks. But with secure SD-WAN, organizations of all sizes can simplify operations, save significant CapEx and OpEx, improve operational productivity, reduce downtime, and improve the patient experience. If you're tired of the same old high costs and manual operations that are always slowing down your operations, let Fortinet show you why secure SD-WAN is for you. For more information, contact us today.
Welcome to the tomorrow of healthcare in the Oracle Cloud. A place where disruption is your reality and digital agility is the cost of entry. This is a world that rewards those who embrace bold ideas, fueled by intelligent data. This is a place where healthcare stays focused on caregiving, where health plans, hospitals, and health systems become active enablers, engaging patients as dynamic participants in their own wellness, where every aspect of the business of healthcare is orchestrated for organizations, intelligently automating, reducing human error, freeing you to progress your mission, where healthcare professionals are nurtured, developed, and given real-time feedback to help them better care for others, where operational excellence and people-first experiences meet clinical excellence, where administrators and caregivers work as one, intelligently and proactively gaining the insight to focus services and resources where they have the greatest impact. Take command of the digital age. The future of healthcare in the Oracle Cloud.
Everyone in a hospital is there for a different reason, and everyone sees a different part of it. Some see waiting rooms and receptionists. Others see patients, doctors, nurses, and family members. The nurses see something else, as do the doctors. The people in charge of supplies see something completely different, as do buyers and all of our supply chain partners. But hardly anyone sees the whole hospital, from clinical to operational, except you. You understand how deep this goes, all the systems involved, the complexity of their interactions, and how to be resilient when things get tough. Managing next-level complexity requires the right tools. Having a digital platform is essential for operational excellence. And Oracle's comprehensive solutions for healthcare providers handle everything: financials, human resources, customer service, and supply chain operations, all from a unified suite of applications, enabling a single source of truth. It's an integrated management system for making better decisions, while increasing efficiency, lowering costs, supporting clinical excellence, and most of all, improving patient satisfaction. Good outcomes are the result of a whole lot of things going right. Most people never see, but matter a whole lot. Find out how Oracle is transforming the future of healthcare.
Complex, costly, difficult to manage, out of date. More healthcare organizations are turning away from complex and expensive legacy branch routers and MPLS lines in favor of secure SD-WAN solutions to become cloud-ready, improve overall user experience, meet HIPAA compliance, and increase high availability to critical patient care locations such as hospitals, clinics, and standalone emergency care centers. SD-WAN solutions aren't just easy to manage, they also simplify WAN operations overall. But at Fortinet, we know that a true solution is only achieved when the networking and connectivity functionalities of SD-WAN are combined with security functionalities, all running on the same appliance with the same operating system managed by a single console. If SD-WAN offerings don't include security, they're little more than another conduit for cyber attacks. But with secure SD-WAN, organizations of all sizes can simplify operations, save significant CapEx and OpEx, improve operational productivity, reduce downtime, and improve the patient experience. If you're tired of the same old high costs and manual operations that are always slowing down your operations, let Fortinet show you why secure SD-WAN is for you. For more information, contact us today